poverty, is rampant in Nicaragua. It is the second poorest country in the Western Hemisphere after Haiti. And people are living in this area in dirt floor shacks, 1-2 rooms, light bulbs from the ceiling, if they even have electricity. Very smoky, very dusty, poor water conditions. There's a huge need. The primary goal of the clinic is to provide primary care and medicines, like we have a pharmacy now, which is fantastic, but also emergency care, we call triage care, and most importantly, the health education part of it. I mean, maybe we got 300 patients in the beginning. It was very new to the community to have the center, and so there was a lot of education and outreach to get them comfortable with the clinic. And so last year we had 9,000 patients. So the clinic has really expanded its services, and everybody in the community is very comfortable with it and has a lot of confidence. Now we also do this outreach program. We continue to do that with our ambulance and with our educational team. So we're seeing, on top of the 9,000 patients a year, about 4,000 patients in outlying communities. These are communities very rural, very hard to get to, especially during the rainy season. These people do not have the transportation or the means to be able to get themselves oftentimes to a nearby hospital or clinic, and so we go to them. So we had our annual health fair last year in Nicaragua, and we had 1,250 people attend. It was wonderful. We also had a surprise visit from Roberto Clemente's son, which is great for the community. But I also just this morning went to our U.S. health fair for the company that I work for here in Baltimore. It was so different, the contrast between the Nicaragua health fair and the U.S. health fair. Frankly, there's not a lot of participation from the Americans because they know they can go down the street another day and easily access these same treatments. We're doing a real estate development on the Pacific coast of Nicaragua. Beautiful area, but very impoverished area. And when we went down, I went down with colleagues and friends of mine, we saw that there was no healthcare facilities, zero for the community. And we're going to be employing a lot of workers, and there's just nothing even for anybody visiting. You had to go an hour away or so to a hospital on a bad road just to get any kind of facility. We were able to partner with the Rotary Club of Pittsburgh because they had already built a clinic in northern Nicaragua. And so they donated plans and expertise. We had the Granados family donate land, which was very nice, as well as some construction equipment. And then we had Rancho Santana, which is the real estate development down there on the Pacific, also help us with support. They were very supportive.
Our most recent accomplishment was to increase the capacity of our clinic to attend more patients. We have a new doctor, and that facilitates the service for 24/7, basically from Monday to Sunday. Anytime people can come to the clinic. We have more nurses. We recently acquired an ambulance that was a huge success for the community. They are very, very thankful that we are providing the ambulance, because before there was nothing. We recently bought an sonogram, ultrasound machine, that is the only ultrasound in the region.
The Roberto Clemente Clinic works with many organizations locally and in the United States. We partnered with them to increase the capacity of our outreach program. Recently, we did a partnership with a Tom Choose, so we were able to receive through them 1,000 and 1,000 pairs to benefit our community. Other type of partnership that we do is the Wheelchair Foundation, which allowed us to bring 110 wheelchairs to our community.
We have 3 main programs that we focus on at the clinic that we're having great success with. And the first one is our Padrino program. And that's where a donor could come in and sponsor a child individually, boy, girl, different ages, but you get to know that child if you'd like through communications. More importantly, you're giving them, for as little as $25 a month or $50 a month, health care, and you're giving them uniforms, backpacks, and shoes. Many of the kids in this area can't afford those things, so they don't go to school. With this donation, they can go to school. And we're seeing an increase in the attendance to schools thanks to this Padrino program. Secondly, we have our very expanded volunteer program. We started with just getting a few volunteers a year. Now we have somebody there almost every week, whether it's a medical professional, a brigade of medical professionals, or pre-med students coming down, spending time in our clinic to either educate our medical team or to learn from our medical team and help the community. And the last is our health fair that we do every year, where we bring in people from all over. We're talking about thousands of people come for everything from inoculations to health education to getting their teeth cleaned. We provide it all there at this big health fair.
Anyone can contribute to the clinic, whether it's monetary for as little as $10 all the way up. We have different levels of donations. We have different programs, specific programs that you might want to gear your funds towards. We have corporate matching programs. And then we have the volunteer program where you can volunteer your time to go down there. I highly recommend it. You'll love being part of this very warm and friendly community. And then also we take like-kind goods as well as donations.
The impact of an individual contribution to the clinic is huge. I mean, you can make such a big difference, so little, whether it's your time, goods, or money. That's what's so wonderful about this community. It's a small community.
Because you're going to take one person and improve their life. You're going to change their life for the better. And, you know, any investor will tell you that's a fantastic return.